Kidney stones on Wegovy can feel like proof that the drug is hurting the kidney. Usually, that is not what is happening. The more common problem is that rapid weight loss can dry the body out and concentrate the urine. That can start quietly. Pain often appears later, after the risky pattern has already been building for days or even weeks without warning. Most people blame the pen too fast. In many cases, Wegovy changes appetite, fluid intake, and stomach tolerance first. That combination can create the conditions that make stones easier to form. So the real problem is the setup around the drug, not direct kidney damage. Another reason this gets missed is timing. People expect the risk to begin when the pain begins. Usually it starts earlier, when fluid intake falls and the urine becomes more concentrated. That shift can happen before any clear warning appears. By the time pain starts, the stone-forming pattern may already have been building for days. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. A kidney stone is a hard crystal that forms when minerals in the urine become crowded together. If enough water is not moving through the urinary tract, those particles can stick and grow. Pain usually starts when they move or block urine flow. That is the basic mechanism. Less water means higher risk. Wegovy, semaglutide, does not usually make that crystal directly. What it often does is change the pattern around it. Some people drink less because they are less hungry and less interested in food and fluids. Others get nausea, vomiting, or diarrhea, especially after a dose increase or after restarting the medication. That matters because dehydration is not always dramatic. A person may not feel obviously thirsty. They may just be drinking a little less every day. The body can handle that for a while. Then 1 week of worse nausea, hot weather, or low intake pushes the urine past a safer range. Food pattern matters too. Some people start repeating the same healthy foods every day during weight loss. Spinach, almonds, beets, dark chocolate, and strong tea can all raise oxalate, a natural chemical that can help stones form. It can combine with calcium and help form the most common type of kidney stone. Calcium is where many people get the story backward. They hear calcium stone and assume less calcium must be safer. That is not always true. Too little calcium in meals can leave more oxalate free in the gut. That can later raise oxalate in the urine and make stone formation easier. Meal replacement patterns can add another layer. Some people stop eating regular meals and rely on shakes, bars, or a few repeated snacks. That can narrow the diet and reduce fluid intake at the same time. It can also lower citrate, which helps stop stones from forming when fruit and regular meals fall too low. The hard part is that this can still look like success. A person may feel more disciplined, more in control, and more successful on the drug. The scale may be improving, but hydration and food balance may be getting worse in the background. The better the appetite effect works, the easier that downside can be to miss. That creates two common risk patterns. One pattern is mostly low fluid intake, the other is low fluid intake plus a repeated food routine that raises oxalate or lowers citrate. Citrate normally helps prevent stones. Both patterns can end in the same problem, but they do not build in the same way. The first pattern often worsens during hot weather, sweating, or weeks of low intake. The second often worsens when low fluid intake combines with the same narrow food routine day after day. A past kidney stone, ongoing diarrhea, repeated vomiting, or gout can raise risk in either pattern. Dose transitions deserve extra respect. Symptoms often get more noticeable after a dose increase or after restarting the drug after a break. That is the time to watch fluid intake more closely. A short run of nausea plus poor hydration can turn a borderline situation into an actual stone attack. So when do those risk patterns turn into warning signs? Early symptoms are not always dramatic. Pain may start in the side or back, come in waves, and then move lower toward the groin. Dark urine, low urine output, burning, nausea, or visible blood can all matter, especially when they begin together. Some signs need action. Fever, chills, non-stop pain, severe vomiting, or inability to keep fluids down can mean more than a routine stone episode. A blocked urinary tract plus infection can become dangerous quickly. That is not a wait-and-see situation. Once those warning signs appear, the priority is to recognize the pattern early and keep it from getting worse. Pain on one side that keeps getting worse matters, urinating much less than usual, repeated vomiting, and dark urine matter too. The goal is to spot the pattern early enough to act before it becomes more dangerous. The first action step is practical. Do not write everything off as a normal stomach side effect. Check urine color, urine amount, whether the pain comes in waves, and whether you can keep drinking. That gives more useful information than simply saying you feel bad on the medication. If pain is severe, if fever is present, or if fluids will not stay down, seek medical care promptly. If symptoms are milder, contact your prescriber and describe the full pattern. Mention low fluid intake, vomiting, prior stones, one-sided pain, dark urine, and any visible blood in the urine. Testing matters because treatment depends on the cause and on whether urine flow is blocked. A urine test can look for blood, crystals, and infection. Imaging can show whether a stone is there and whether it is blocking urine flow. A small stone that is passing is treated differently from a larger stone that blocks urine flow. Infection changes the plan again. Even after treatment, prevention starts earlier than most people think. Steady hydration across the day matters more than trying to catch up at night. Very dark urine is an early warning sign. Pale yellow urine is a better target than guessing from thirst alone. Variety helps. Repeating the same high oxalate foods day after day can backfire during weight loss. Keeping regular meals and a more mixed food routine usually works better than trying to eat as little as possible. Salt and supplements matter as well. Higher sodium intake can raise calcium in the urine, which can make stones easier to form. Large vitamin C supplements can raise oxalate in some people. Random supplement stacking is not a smart shortcut here. The bottom line is simple. Wegovy usually does not create kidney stones directly. The bigger risk comes from the pattern rapid weight loss can create, especially low fluid intake, concentrated urine, vomiting, and a narrow diet. Catch that pattern early, and the problem is often much more preventable than it first appears. Medicine. Simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.